Good afternoon, everyone. So the topic that is assigned to us is child abuse. These are the reporters: Jones Carbonilla, April Gabano, Kendrick Ilacas, Sarah May Nakita, Donna Salchua, Rafaela Garduque, and Martina Valencia. May Nakita, and I am in charge in the giving the description or the background. So, according to Child Health, child abuse, it is when a parent, guardian, or a caregiver, whether through action or failing to act, causes injury, death, emotional harm, or risk of serious harm to a child. So there are forms of maltreatment. Actually, there are six, but I only write four of it. So we have here the physical abuse, emotional abuse, sexual abuse, and the bullying and cyberbullying. So as we know, there are stages. We have here the newborn. Newborn, it is during the first month of life. And we have the infant. Infant is, this is when the development of new abilities quickly happen during the first year of the life of an infant. And we have the toddler. It is between 1 to 3 years old, and the um, preschooler or preschool ages 3 to 5. Then we have here the school age 5 to 12 and the adolescents. So these forms of maltreatment can be experienced by the infant, newborn, toddler, preschooler, or the adolescent or the school age. So first, let's discuss one of the forms of maltreatment, which is the physical abuse. So physical abuse, it says here, when a parent or guardian or a caregiver cause any physical injury to a child. So even if a caregiver didn't mean to cause injury, when the child is injured, it is abused. Physical discipline from a parent that does not injure or impair a child is not considered as abused. However, non-violent alternatives are always available. So we have physical abuse includes sticking, burning, hair pulling, shoving, biting, choking, and the physical abuse can result in bruises, blisters, burns, cuts, and scratches. It can also result to internal injuries, brain damage, broken bones, sprains, dislocated bones, emotional and physiological harm, and a lifelong injury, or worse, it can lead to death. For the signs and physical abuse in parent or caregiver, we have here can't or won't explain injury of child, or explains it in any way that doesn't make sense, displays aggression to a child, or overly anxious about child's behavior. It also indicates child is not trustworthy, a liar, or a troublemaker. It delays or prevent medical care for a child. It also takes child to different doctors or hospital and others. Okay. So the signs of abuse in a child is we have here any injury to a child who is not crawling yet, visible and severe injuries that can be seen physically to a child. It can be to newborn baby, toddler, infant, school age, preschool, or to any adolescents. So injuries at different stages of healing on different surface of the body. It can be seen in physical injury that can be seen um, in any parts of the body. Then the unexplained or explained in a way that doesn't make sense. Distinctive shape, frequency, timing, and history of injuries frequent after weekends, vacations. So we have here, usually this is the behavioral behavior of those children who experiences physical abuse. We have here the aggression towards peers, pets, or other animals. Seems afraid of parents or other adults. Fear, withdrawal, depression, and anxiety. Actually, those children who experience physical abuse can lead also to depression and anxiety, feeling of fear. So that's, and we also wears long sleeves or out of season. Sometimes they're weird. So they also have violent themes in fantasy and art. So it can be seen through their actions. And they have most of the time nightmares, insomnia. You can know that they have report of injuries, severe discipline, and sometimes you can see immaturity in them and through their attitude also. So we have here sexual abuse. The second one, sexual abuse happen when an adult involved in a sexual act. So sexual abuse occurs when an adult uses a child for sexual purposes or involves a child in sexual acts. It is also includes when a child who is older or more powerful uses another child for sexual gratification or excitement. It is also includes when a child it is also includes um wait, it also includes when a child who is older or more powerful uses another child for sexual gratification or excitement. So we have here the sexual abuse of children includes non-contact abuse. So this non-contact abuse, it is when a child is abused without being touched by the abuser. It can be online where the body is exposed or showing pornography. So next is making a child view a sex act, making a child view or show sex organs, inappropriate sexual talk, contact abuse, funding and oral sex, penetration, making children perform a sex act, exploitation, child prostitution, and child pornography. Okay, so this is the signs of sexual abuse in parent, caregiver, or to a guardian. So we have here parent fails to supervise their child, um, have unstable adult presence, jealous, possessive parents, sexual relationship troubled or dysfunctional, parent relies on child for emotional support. And these are the signs of sexual abuse in a child. We have here through their physically, we can see a difficulty of sitting or walking. There's a blood under their garments. There's bleeding, bruises, pain, swelling, frequency of urinary tract infection. This is the possible thing that will happen to a child. Any sexual transmitted disease or related symptoms. So in their behavior, we can observe that they are having anxiety. So for the emotional abuse, it says here that harms a child's mental or social development or causes severe emotional harm. So these are the signs of emotional abuse in parents or caregiver. Routinely ignores, criticizes, yells, or blames a child. place favorite with one sibling over another, poor anger management or emotional self-regulation, stormy relationship with other adult, disrespect for authority, history of violence or abuse, untreated mental illness, alcoholism, or substance abuse. So, emotional abuse also includes rejection or ignoring. It is telling a child he or she is unwanted or unloved, showing little interest in a child, not initiating or returning affection, not listening to the child, not validating the child's feeling, breaking promises, cutting childs off conversation. We have also here the shaming or humiliating. It is calling a child names, criticizing, belittling, demeaning, mocking, using language, or taking action that takes aim at child's feeling of self-worth. We have also the terrorizing. It is accusing, blaming, insulting a child. And we have also here the isolating. Isolating, it is keeping the child from peers or positive activities. Positive activities. Okay. So this is the signs of emotional child abuse. We have here physically, we can see that there's a delay of development. In some cases, it is because of the trauma that happened or that the child experienced to their parent or caregiver. Then wetting bed or pants, and there's a possibility also of speech disorder. I personally have seen this, that those children who struggle or experience emotional abuse to their parents experience speech disorder and obesity and weight fluctuation. So for the behavioral, learning disabilities and developmental delays, yes, there's late development to a child, overlying compliant or defensive, extreme emotions, aggressions, withdrawal. There's also anxieties or phobias. There's also a sleep disorder and destructive or antisocial behavior. They they may be sometimes violent, cruel, and sometimes lying, cheating, and stealing. And behavior that is inappropriate appropriate for age too adult or too infantile. And there's also a suicide thoughts and behaviors that you can observe to those children who experience or who came from emotional abuse. Then we have here the bullying and cyberbullying. So bullying is repeated, targeted, aggressive behavior that uses force, threats, teasing, and embarrassment to hurt children who are younger or smaller or over whom they have power. So, bullying is repeated target, like what I've said. So, bullies uses force, threats, and an and or embarrassment to hurt children who are younger to them. So, bullying can be personal, can be a person physically, or it can be also emotionally, or it can be both. Okay. One of the out of every five, there's 20.2% student reports being bullied, according to the National Center of Education Statistics 2019. So bullying can include verbal bullying like teasing or name calling. Social bullying involving shutting a child out of a group or spreading rumors and embarrassing them in public. Then we have also the physical bullying like kicking, hitting. And for the cyberbullying, it is the repeated, targeted, aggressive behavior that takes place online or on digital devices through email, chat, text, and it also includes sending, posting, or sharing hurtful or embarrassing information or images to exclude and shame the target person. So, so cyberbullying can include posting comments or rumors online about a person that are mean or hurtful, and and sharing or posting embarrassing or upsetting pictures or videos telling a person to commit suicide, threatening them or threatening someone over text or online, sharing someone's private information, typically as a revenge for perceived wrong, then ruining a person's reputation by adopting their identity and posting negative content as as them deliberately and publicly exclude the person. So this bullying and cyberbullying are most common to adolescents. So this is the signs that someone is bullying you. Often fights, physically or verbally, blames others for their problems, can be aggressive, gets into trouble at school, parts of clique that looks down on others, concerned about status and reputation, has unexplained new possessions or extra money. Then for the physical, unexplainable injuries, loss or damage of clothing and possessions, coming home hungry because they don't eat lunch because someone gets their money by force. So for the behavior, they most of the time complaining often of illness and wanting to stay at home from school because they are afraid, having trouble sleeping or frequent nightmares. Sometimes it is because of the trauma that they experience. Then declining grade, loss of interest in schoolwork, or none wanting to go to school. This is the effect of those who experience to be bullied by someone. So they don't want to go to school anymore because they are afraid. Their grades are also affecting that experiences that they they are with. So a sudden loss of friend or avoidance of social situations, feeling of helplessness or decrease of self-esteem. Sometimes or most of the time, this feeling of decreasing self-esteem mostly affect the adolescents who are experiencing cyberbullying or bullying. It mostly happen in schools. So we have also here the self-destructive behavior such as running away from home, harming themselves, or um, yeah. So some of also um, behaviors, they also having an anxiety, depression, um, sometimes they're having a thought of suicidal when it is really below the belt, when they can't handle their what they are experiencing anymore. So this is the signs for the cyberbullying. Many signs of being a bully apply in addition to points below. So it is to avoid talking about online and digital activities or boast about online presence, has multiple online accounts, shutdowns program, turn off screen when someone approaches. For the signs that a child is being cyberbullied, so the child is mostly nervous, upset, frustrated when texting or going online, reluctant to talk about online activities, or um, hesitant to use computers, tablets, or smartphones. there's also a signs of depression, decreasing or having a low self-esteem also, and self-worth. Many of these signs as a bullying in the physical world, such as loss of friends, frequent illness, and having a trouble in sleeping. So in here, 28.3% according to Child Health, there is 28.3% who experience um being adult report being child abused physically, and then 20.7% reported sexually abused, while there is emotionally abused 10.6%, and for the child 20.2% for those children and students who reports being bullied in school. So, as we know, as this pandemic start, there are um, mostly child abuse like cases has been like it's not their priority anymore. But as COVID started, there are research that says there's a possibility that it will increase more. Those children who experience child abuse will increase more as COVID, since maybe most of the children are at their homes. So that's yeah. So that's the end of my part. Now I'm giving it to the next reporter. Thank you for listening.
Hi everyone, I'm Donacel Chua, and now I am going to share about the etiology and risk factors of child abuse. So, there are many things that can cause child abuse. The reasons are often complex and there's no single or simple explanation. So, most parents want to love and care for their children in a safe home. So, stress, tiredness, or lack of parenting skills or family support make the pressures of caring for a child overwhelming and can cause abuse. So, first, let's talk about the etiology. So, why some people hurt children? So, here we have five etiologies. So, first, lack of parenting skills or lack of knowledge of child's needs. So, most parents are naturally gifted while caring for their children, but few may not be able to manage their physical and emotional needs adequately. So, many parents would often equate disciplining their children with abusing them and will need counseling to understand the role of a parent in a better manner. And the next is alcohol and drug abuse. So, parents who have a history of alcohol and drug abuse can be responsible for child abuse. So, dependence of substance abuse is one of the major causes of child abuse and maltreatment. So, which includes physical abuse and intentional neglect. So, alcohol or drug abusing parent is more likely to initiate child abuse with kids of 5 years old or below. And the next is untreated mental illness. So, a parent's untreated mental illness is a common cause of child abuse. So, manic depression, or the other word for bipolar disorder or other illness of the mind, can become a prime cause for the parents to be unavailable for the child. So a mother may remain withdrawn from her kids, or in extreme cases, suspect that the child plotting against her. So a parent's suffering is often the cause of subjecting a child to abuse. And then next we have lack of resources. And lastly, we have stress and lack of support. So many children face psychological mistreatment or psychological abuse when their caregivers or parents are under stress. So parents find it difficult to deal with the emotional needs of a child, especially when they face stressful situations like divorces, like relationship issues, like financial worries, and job related problems. So these can lead to parents meting out abuse to their children. And now let's proceed to the risk factors. So the World Health Organization, or WHO, identified several risk factors for child abuse. So not all risk factors are present in all social and cultural contexts, and the list here provides an overview when attempting to understand the causes of child abuse. So it is divided into four categories. So first is the child, then the parent or caregiver, and then the relationship, and then lastly the communities and societies. So first, let's proceed to child. So it is important to emphasize that children are the victims and are never to blame for abuse. So characteristics of an individual child that may increase the likelihood of being abused include the following. So, first, having special needs, then crying persistently, having abnormal physical features, and then having an intellectual disability or neurological disorder. And then next, let's go to parent or caregiver. So, the characteristics of the parent of a parent or a caregiver that may increase the risk for child abuse include the following. So first, difficulty bonding with the child, and then having been maltreated themselves as a child, and then suffering from poor impulse control, and then having a mental or neurological disorder. And then next, let's go to the relationship. So, characteristics of relationships within the families or among intimate partners or friends, or it may be peers that may increase the risk of child abuse includes following. So first, we have the family breakdown or violence between other family members. And the next, lack of support network. So this lack of support network is common to many families, di ba? There are some families na kulang sila sa support from the other members of the families. And then lastly, breakdown of support in child rearing from the extended family. And then the last category, the communities and societies. So the characteristics of the communities and societies that may increase the risk for child abuse includes the following. So first, the lack of adequate support. So if the community or if the society lacks adequate support to the family, it may increase the risk for child abuse. And the next, easy availability of alcohol and drugs. And then inadequate policies and programs to prevent child abuse. And then now let's proceed lastly to the facts. So here I have gathered some facts about child abuse. So, according to World Health Organization or WHO, 3 in 4 children, or 300 million children aged 2 to 4 years, regularly suffer physical punishment and or psychological violence at the hands of parents and caregivers. And 1 in 5 women and 1 in 13 men report having sexually abused as a child age 0 to 17 years. So this information is from the World Health Organization or WHO. And lastly, child younger than 1 year old are most likely to be victim of child abuse. So this is according to the Centers for Disease Control and Prevention. So that would be all. And thank you for listening.
Good day, everyone. The next part that we're about to discuss is about clinical manifestations. So, before we start, please excuse the sound effects that I have. So, the next slide. Warning, it says warning. Parents may seem to be inconsistent with their stories due to language or cultural differences, or to being embarrassed or afraid relating to some other issues. So cultural and language difficulties may also lead to delayed care. So we need to consider differences in terms of culture, language, and lifestyle. And then accurate questions are encouraged and important to have a thorough assessment. So red flags with injuries. This is so important not to notice because a child who's being abused may feel guilty, ashamed, or confused. Child might be afraid to tell anyone about the abuse, especially if the abuser is the child's parent or other relative or family friend. That is why it is vital to watch for red flags, because these red flags might serve as our cues and clues towards child maltreatment. So next, this is the exact common red flags that we might encounter along the way. So explanation doesn't fit the injury as to pattern, timing, or developmental ability of the child. Explanation keeps on changing. Child is consistently blamed as cause of their own repeated injuries. Delay seeking medical care and frequent change of care provider. So then, as you can see, signs and symptoms are divided into three categories, which is behavioral, symptoms, and physical clues. So the difference between symptoms, clues, and physical clues is that a symptom is a manifestation of disease apparent to the patient himself, while a physical clues is a manifestation of disease that the physician perceives. So this is the first clues that we're going to discuss is behavioral. So these are some of the behavioral clues. Excessive crying or developmental delays might also appear on the child, as well as fear, anxiety, and clinging that could possibly develop aphobias, or maybe the child might develop also the sleeping problems or experience bedwetting, social hyperactivity, and then social withdrawal. So from this point, the child might experience depression, passivity, and it may show that the abuse is afraid to the abuser. As the child develop fear and anxiety, develop defense mechanism will develop, and it will manifest through increased verbal abuse or physical aggressive behavior with other people, or not just to the other people but also to themselves through self-harm or by destroying or injures objects or pets. And then poor concentration or distractibility that could lead to decreased school performance, chronic school absenteeism, speech disorders, and then symptoms of PTSD, eating issues, substance abuse, and then lastly, withdrawal to touch, sexualized behavior that could show from avoidance of getting undressed. It will manifest through that. And then the next one is examples of symptom clues: headaches, abdominal pain, chronic, and acute. So, abdominal pain acute, usually there are traumas na it's not uh, that there's no external marks, so we need to look for this tension, check the tenderness, and auscultate bowel sounds. Then vague somatic complaints, tapos worsening medical problems like asthma, and then frequent unexplained sore throat, abnormal weight gain or loss, and then difficulty walking or sitting that can be also shown through being reluctant of using an extremity, and then genital discomfort or painful urination or defecation, unexplained symptoms. When this happen to, kapag nangyari rin to, look for any poisoning or forced ingestion of water or salt to the child, and then vomiting, irritability, or abnormal respiration that may present head trauma. And then the following photo that you can see on your screens are the possible physical patterns that a child have or might possess after the maltreatments that they receive from their abuser. So on your left top part, which is the figure 1, excuse me, child was gagged and his hands were tied. Marks from the maltreatment will form a bruise around his mouth, and blister and edema in acute binding injury will be left on his tied hands, which is on his wrist. Yan. And then for the figure 2, typical slap pattern. And then for the bottom part, the middle, loop or cord marks on the buttocks after getting hit by loop or cord something. And then the last one is bite pattern. So as you can see, 3 centimeter or greater distance, it indicates adult bite. So the next photo that you can see is stages of injuries were indicated on the middle photo. Ito, acute bruise with mark swelling will be shown from 1 to 3 days. And then purplish color around the eyes with swelling still happen around 1 to 3 days, 1 to 5 days rather. And then as the healing process continued, marks from being violet may turn into green, 5 to 7 days. And then from being green to yellow, 7 to 10 days, and it will turn into brown after 10 days. So as you can see, there are like other fractures like fractures and hematomas, which will be probably discussed in diagnostic tests. But as you can see, further examination may reveal bruise, wells, or cigarette burns in various stages of healing on the other side of the body. So we need thorough assessment and thorough physical assessment. Thorough interview and thorough physical assessment. Yes, this is the fractures and this is the hematoma. So on the last part, on the signs and symptoms, last in our list is physical clues. These are the most common manifestations of abuse, which are from the skin, bone, or CNS. So first one is poor hygiene. I know, dress inappropriately for weather, and then poor hygiene, the failure to drive that could possibly lead to poor weight gain or malnutrition, lack of medical care or needs, fractures, dislocation, bruising, and defensive injuries on their forearms. So bites. Human bites are more superficial than animal and it will show up better 2 to 3 days later. So as for the burns from cigarette like like burns from the cigarette, rope, immersion, or shape of hot object. Excuse me. Size of restraints on axilla and other extremities as a defense mechanism. Trauma to ear, lacerations, traumatic hair loss, facial injuries without good explanations, and then oral, dental, and head injuries. Oral or dental injuries such as torn or bruised lips, teeth, palate, tongue, or oral mucosa. Head injury, mental status change, hemorrhage and hematoma, abdominal trauma that usually to multiple organs, bruising, tearing, bleeding, and discharges from genital area as a sign of sexual abuse. And then another is diagnosed STD or pregnancy. So this is the sciences of sexual abuse. Basically, lacerated hymen for female. Half of them is almost lacerated because of forced insertion. Victims are usually most often school-aged and adolescent girl. And then for the male, bruised, swollen scrotum and penis resulting from twisting injury. And as for their anal area, both males and females should be inspected for evidence of abuse such as lacerations, infected lesions, and poor sphincter tone. So these are these you can see here. On the top part, this we need to examine this, and this will be our clues for sexual abuse. So yeah, that's all. Thank you. Have a nice day.
Hello everyone, this is Martina Valencia, and my part for this reporting is to share about the diagnostics and laboratory tests done for child abuse. So the suspicion of child abuse may arise because of the pattern of injury that is found. In example, an injury at a typical site where blows are typically struck or with a typical appearance, such as parallel stripes. The plausibility of the proposed mechanism of injury is of prime importance. Aside from this, a number of circumstances of other types can indicate the likelihood of child abuse. So if you're doing a physical assessment and you see that there are bruises at the buttocks of the child, or there are wounds in shapes of stripes, these aren't typical for children, because spanking a child is normal depending on your disciplinary method, but those kind shouldn't bruise, right? So to continue, so injuries to multiple areas, injuries in various stages of healing, and specific patterns of injuries are suspicious for physical abuse. Why is that so? So bruises in many stages of healing means that the bruises were applied or were caused in different timelines. So that means that the child is being hurt in different timelines or in multiple scenarios. So that's really suspicious. So specific patterns, if the pattern is elongated or there are like long lines, it might be caused by belts, hangers, or slippers. So what are the things to look for this kind of scenarios? So hematomas, bruises in multiple stages of healing, multiple scars in different lengths and stages of healing, malnutrition, extensive dental cares, untreated diaper dermatitis, and neglected wound care. So this first 1, 2, 3, and also the neglected wound care, these are signs of traumas or like initiated blows to the body, while this malnutrition and the rest of these two are signs of neglect, which is also a form of child abuse. So these are the examples. These are bruises and these are hematomas or traumas brought by blows. And this is an example of malnutrition. So what tests can be done for this type of scenarios? Physical examinations. So the child should be fully undressed and the whole body should be examined thoroughly, including the anogenital region. The growth parameters should also be measured and noted in percentiles. Injuries should be described precisely with indications of their localization, size, shape, and nature. When indicated, the contour of the injury should also be described. In example, when this provides a clue towards the type of object which the child was struck. All injuries should be measured and photographically documented. So when the injuries are identified during an examination, it is appropriate to ask the child or the parent if the child is pre-verbal how the injuries occurred and if it's significant whether the child was seen for treatment of the injury. So as a nurse, while assessing and then suddenly you see multiple bruises, you can ask the child, where does this come from? What did you do? What happened? So by asking that, you could get clues from how the child answers. If the child answers anxiously or scared, or it brings up a negative emotions from the child, that could be a cause of suspicion. Or if the parent is dismissive about it, it's like the child just fall down the stairs like that, that could be suspicious as well. And also if they answer, if the child got treatment for that, means that they are very attentive to the child's needs. But if they said that it was okay, that it didn't need any treatment, even though it's obvious that it needed treatment, means that they're not neglecting the child's needs. So the next scenario is skeletal injury. This is an example of a skeletal injury. So most fractures in childhood are results of accidental traumas, and a small percentage of fractures that result from abuse are mostly found in infants. Why is that so? So as we all know, infants are very much fragile. Their bones are not that hard yet, and they are really prone to fractures. So abused infants and children may present with skeletal traumas as their sentinel injury. And fractures are regularly identified by skeletal radiographs during the medical evaluation of suspected abuse, as well as other conditions. So this is an example of a radiographed fracture. So these are the things to look for. Fractures in non-ambulatory infants, especially in those without a clear history of trauma, or an unknown condition that predisposes to bone fragility. So if you ask yourself, how can a non-ambulatory child or an infant have fractures, right? So they don't have the means yet to walk around, to be in an adventure. They're basically on the bed or in a cot. So how can this child have fractures if it doesn't have any predisposing sickness or disorders that can cause the bone to be brittle? Children with multiple fractures and infants and children with rib fractures, mid-shaft humerus, or femur fractures. History of trauma that does not explain resultant fractures. Infants and children with unusual fractures in scapula. Classic metaphyseal lesions of the long bones, vertebrae, and sternum, unless explained by known or of severe trauma or underlying bone disorder. So if you carry a child, it is often around the rib area, right? So if you squeeze the child really hard, that will be causing trauma or fracture. So, but you don't normally squeeze infants, right? So it is a warning sign if the child has fracture around the rib area. So these are examples of fractures in infants. This is a intercranial fracture. This is a femur fracture, and this is a picture of a rib that is not fractured. Next, what test can we do for fractures? So we have here, as mentioned earlier, is radiographic imaging. So physical abuse often results in skeletal injury. Radiographic imaging of children with suspected physical abuse may consist of evaluation of localizing symptoms or physical examination signs, as well as screening skeletal surveys. Skeletal surveys imaging is typically recommended for all cases of suspected abuse in children younger than 2 years. Children older than 5 years can usually give a sufficient history of pain, and screening imaging is not recommended. So, because we have infants who can't really express or tell the nurse what happened, we have this skeletal survey imaging to do so, because asking the parent or asking anyone secondary source of information, they may give false statements. So it is better to get a diagnosis with these kinds of tests because they are truthful, and after that, if the child is able to express what happened and they are not under the psychological trauma by the parent, you could ask them on their own without the presence of their parent if or guardian if abuse is suspected, of how they got the bruise or how they got this fracture, and hopefully they give you the scenario of what occurred. So another test that can be done is the CT scan, or the contrast enhancing computed tomography. So this is helpful in determining the type and severity of an intra-abdominal trauma, and are warranted when screening laboratory tests indicate possible abdominal trauma in all cases of symptomatic injury, the most cases when the physical examination is unreliable because of the patient's age, for example, like baby pa. Presence of other injury that may obfuscate the abdominal examination, or presence of accompanying head injury. Surgical consultation is required for children with afflicted abdominal injury. So abdominal injuries are also common with child abuse. So next tests that can be done are laboratory studies. They are useful to identify disorders that may explain observed findings, or usually coagulopathies or occult or more severe injuries not evident on examination. Testing for sexually transmitted infection may be necessary if sexual abuse is suspected. So abuse that does not only circle around physical abuse, it could also be mental abuse, sexual abuse. So with sexual abuse, other than physical examination for hematomas or bruises around the vaginal area, you could also check for STDs if sadly that had occurred. So these are the things that you could look for: liver enzyme test, aspartate aminotransferase and alanine, aminotransferase, pancreatic enzymes, amylase and lipase, urinalysis. So symptomatic children can present the signs of hemorrhage on or peritonitis. This is the inflammation of the peritoneum. But many children will not display overt findings, or their abdominal traumas may be masked by other injuries because this is internal. So it can be covered by other external injuries. So screening laboratory tests including liver and pancreatic pancreatic enzyme level are important to obtain in all children who present with serious trauma, even if they do not display acute abdominal symptoms. A urinalysis may also identify trauma to the urinary tract and kidneys. So in simpler terms, laboratory tests are done for injuries that are not externally seen because some injuries are manifested inside and not externally. So thank you. That will be all. If you have any questions, you could send them in the group chat or message me personally. One of the things that are not mentioned here are psychological tests. As nurses, we don't have the training to do these kinds of tests unless we are specialized psychiatric nurses. But as nurses or as medical professionals, we could refer them to psychiatrist or a psychologist for further evaluation. So that will be all. Thank you for listening. So these are my references.
And now I will be sharing about the medical management of child abuse. Once physical abuse of a child is suspected, the physician is required by the law to report it to authorities. Medical management can range from inpatient care to outpatient treatment with close follow-up by a physician, a social worker, and child protective services. Inpatient care helps address medical needs, facilitates studies, observation, evaluation, and protects the child from further harm. Criteria for considering admission includes medical indications. Examples are severe burns, head injury, and requirement for serial examinations. Unsafe home environment, delayed outpatient, child protective services evaluation, and inpatient observation of child-parent interactions. If the parent or guardian is suspected of being a perpetrator, then inpatient evaluation is appropriate. A multidisciplinary approach or child protection team is strongly encouraged to ensure adequate evaluation, treatment, and follow-up of a potentially abused child. Recommended members for a multidisciplinary team includes the admitting or evaluating physician, a children's physician or children forensic specialist, child protective services, social work services, nursing staff, mental health professionals, and law enforcement. Documentation of the history, physical examination, diagnostic study results, clinical impression, and diagnostic reasoning is vital not only for medical care but also for legal purposes. This includes photography of physical examination findings that raise concern for abuse. Although digital photography has largely replaced traditional film, a few principles should be followed to provide the best documentation regardless of the technology.
Next topic is nursing responsibilities, where we'll be taking a look at the nursing process, also known as ADPI by Orlando. The first step of the nursing process is assessment. So the first thing to do is always ask the parent to account for the child's injuries, because more often than not, the parent will admit that they're abusing their own child. So when a parent paints this scenario that is out of proportion to what the child is actually suffering, it is indicative that the child is subject to abuse. And for example, the book gave an example. I think it was a child suffering was a hematoma and a concussion, while the parent said that the child was under a coffee table and he bumped his head. It is very unlikely that that happened, and the nurse can indicate that the child is indeed subject to abuse. Ask about behavior in school. So for all this abuse going on, the child will undergo a lot of stress, and that stress may be put out to his classmates, his teachers, anyone at school. So it's very important to to ask about how they're doing in school. And in these situations, it's very important to remain objective, because it is very easy to judge the parent and to question their actions. But the fact of the matter is they came in for help, which is already a step in the right direction. And it's very important to assume that the parent is doing their best in their given circumstance. So being there to help, because we're there to help, not to judge, is very important. Common signs of physical abuse, as mentioned before I believe in the clinical manifestations. Hand injuries, because of parents usually are very protective of their children's hands. So any hand injuries can be already of suspicion, especially burns on dorsal face. I put this because typically when children burn themselves, it's on the palmar face of their hands. So a burn on the dorsal face can indicate a deliberative burn. And cigarette burns, they resemble impetigo, just like a cigarette, but the scar will be circular in shape, as well as bites, hair pulled out, head injuries, and large bruises throughout the body, which, especially for children who can't even walk yet, let alone kind of throw themselves around, is very suspicious to abuse. Failure to thrive. It's a syndrome where infant falls below 5th percentile for weight and height on a standard growth chart. There are two factors that influence this. They're organic and non-organic factors. Organic being things like cardiovascular disease. However, we're going to focus on non-organic, which has something to do with the parent and child relationship. So here we have poor muscle tone, loss of subcutaneous fat, skin breakdown, rocking on all fours excessively, and hungrily staring, which already sounds like a nutritional deficiency. But in these examples, hungrily staring, I want to point out, obviously children they do tend to stare, but being able to identify just a stare from a stare that shows deprivation of human contact is very important for the nurse to be able to differentiate. Did I skip one? No. So assessment. I believe this picture was used also in clinical manifestations, but here we can see that there's some very obvious ones, like an imprint on the hand on the face is very obvious of slapping, as well as on the buttocks. Here they use loop or cord. Tying of the hands tight enough can leave bruises. On the wrist, here you have a cloth. On the cheeks, which can leave a mark as well. And biting, that leaves marks of human teeth. Diagnosis, I put a handful of diagnoses here that all have to do with abuses, but different kinds of abuses. So risk for injury, which is physical abuse related to documented abuse by the parent. Imbalanced nutrition related to parental neglect on nutritional status, which again is related to the failure to thrive syndrome. Impaired parenting related to lack of knowledge, situational crisis, ineffective role modeling, or unmet social and emotional maturation needs of parental figures. If I didn't mention before, the parents can be as much of a victim as the child is, because they just simply don't know how to parent, or they have unmet needs themselves. Anxiety related to rape is another diagnosis. Planning, the first thing, pretty much the priority, especially when dealing with a child, is to ensure safety of child and minimize effects of trauma. We'll mention later in this slide that might need to take a family member out of the household and kind of put them somewhere else, hospital, rehab, whatever. report abuse as mandated by law, reestablish a self-esteem through self-help advocacy program. That has to do more with rape or sexual abuse. Planning. So here I have on this slide, I have on the left side in red is the goals, what goals we want to achieve, and their related diagnosis on the right. Child has no further physical injuries identifiable as being inflicted by abusing parent, which is for the nursing diagnosis, risk for an injury related to documented abuse by parent. Child shows interest in bottle feedings. Child is able to establish a regular eating pattern. Child begins to gain weight. Back to where they should be. Kind of reversing all the harm that has been done. Perhaps not reversing in the first scenario, just stopping the abuse. Imbalanced nutrition, less than body requirements related to inadequate intake, secondary to emotional deprivation. More goals related to their nursing diagnosis is victim is able to discuss, again this is a rape incident, what happened and voice intense feelings of the crime, states ability to move forward in life. A client identifies positive traits about self, plans for future. This is from chronic low self-esteem related to continuing physical and mental abuse. So for these two goals, for the client, we want them to be able to transition into the healing stage, kind of think about the future and grow from there. Implementation, so prevent further abuse. Like I said previously, child or abuser must be removed from home. And as nurses, we must provide care to abused child, evaluate and promote family health. Evaluate and promote family health. Obviously, there's abuse going on in the family, so we want to make sure that everybody is doing okay. Everybody has their needs met, and kind of dig deep to the root and the reason for the abuse, for all the harm that they're putting out, and kind of identify it and fix it. Provided care to abused child, like I said, which we'll discuss more here. To nurture the child, where the nurse needs to take role of parenting during hospital stay. Obviously, an abusive relationship of a parent, they're not being the parent that they should be. So the nurse needs to take on the role of being the parent that the child needs. For these, it's not as simple as, simple care. You really got to spend time, perhaps even play games with them, really build a relationship, kind of comfort them and help them heal. And the next one, support and encourage parents. Encourage parents to spend quality time with their child, which they might not already do. So encouraging them, kind of teaching them the importance of parenthood, and teaching them to kind of talk to their child, to feed their child, even hold their child, to really strengthen the broken relationship. Last but not least, evaluation. So evaluate client's knowledge. Parent admits to losing control with children at home. Voices desire to undergo counseling for problem, which is related to the parent abusing the child. Ensure follow-up. Ensure child's needs are continuously met, because not always will they be healed just by one hospital visit. As a nurse, you really got to make sure that the plan is going through, that the family is trying to change and leave behind their abusive relationship. Adolescent states, I put she, but it can be he, thinks highly of self despite rape by family member. Like I said before, the transition to a healing state and moving on is the path to healing. And I believe that's it for the nursing process of nursing interventions.